Welcome to our presentation on naloxone kits and overdose training by me, Elizabeth, and Yevon. Naloxone is a lifesaver drug. It's a fast-acting drug that is used to temporarily reverse the effects of an opioid overdose, which can include heroin, fentanyl, and morphine. Naloxone rushes to the brain by stopping the drug from impacting brain receptors. Naloxone can help an individual regain breathing within 2 to 5 minutes, and it is generally safe for all ages, but only works if you have opioids or drugs in your system. Naloxone is an active drug in the body for 20 to 90 minutes, but the effects of most opioids can last longer. That being said, the effects of naloxone are likely to wear off before the opioids are gone from the body. This can include difficulty of breathing to start again. It's important to call 911 when that happens. Naloxone is safe to keep on hand as it cannot be used or administered improperly nor creates a dependence. Identifying the program and why we chose this, Yevon and I picked naloxone kits and overdose training as a harm reduction topic, primarily on the fact that we weren't as educated on this topic as we would like to be. By choosing this topic, it allows us as inspiring law enforcement officers to understand the need for harm reduction programs, as well as becoming familiar with naloxone, specifically through its effects and benefits. The rise of opioid uses and overdoses across the GTA is a concern and shows the importance to know how to help individuals. Overdose training takes less than 10 minutes and provides vital information on prevention, recognition, and responses to an overdose. When done training, you will receive a kit with 2 doses of naloxone and instructions for administering the medication. Kits can be provided by pharmacies, drugstores, community-based organizations, and health centers. The Red Cross and St. John's Ambulance also provide opioid response training. These programs are designed to help the community and help those seeking safety. Naloxone kits are available for individuals who are at risk of an opioid overdose, a family member or friend that wants to help someone at risk, a client of needle exchange and syringe programs, or a newly released individual from correctional facilities. What is harm reduction? Harm reduction is an activity that reduces the risk associated with the negative effects of drug use while not necessarily focusing on ending or preventing drug use. Programs are designed to alleviate stigma on negative social, health, and economic consequences. Harm reduction programs are directly and indirectly connected to first responders and is highly controversial. Harm reduction is a key element of treating public health in substance abuse. The program used with naloxone kits is focusing on harm and the involvement of people who use drugs. Focusing on harm programs shows the priority of harm reduction through decreasing negative consequences of drug use to the users and others. In this program of focusing on harm, it is complementary to the abstinence model of addiction treatment. The naloxone kit and overdose training also contribute to the involvement of people who use this drug. This practice is designed for those actively participating in drug use who are seen as the best source of information about their own drug use. It also empowers others to join with service providers to determine best intervention practices to reduce harm and drug use. With these principles in action, harm reduction can help individuals who are living with addictions to stay alive until they are ready for successful treatment.
History of the program and accessibility. Naloxone distribution training helps any. Naloxone distribution training has helped save many lives throughout the years by preventing overdose in crucial moments. Developed in the 1960s by Jack Fishman, naloxone is a form of medication distributed through intranasal or intramuscular injections that block effects of opioids in the brain. The base for this program is use of accessibility and rapid response in crucial moments when first aid is not available and ambulance still has way to come. Learning to use naloxone takes up under 20 minutes and it is as simple as using a nose spray or an allergy pen. Government of Canada provides free kits to anyone for individual or family use, and they can be acquired from most healthcare providers and pharmacies. Additionally, all organizations eligible for naloxone are those who are suffering from opioid crisis, or community services such as aid service organization, shelters, withdrawal management programs, and community health centers, including Aboriginal health services. Certain agencies collaborate with naloxone distribution and also provide valuable data research. Naloxone distribution training programs are tools that are part of a larger universal strategy aimed at reducing harm from overdose, and therefore all major healthcare and mental health agencies collaboratively offer it. Within Greater Toronto Area, naloxone training can be obtained from the following agencies: MH, Ministry of Health and Long-Term Care, Ontario Naloxone Program, Ontario Harm Reduction Network, and PARN. The following data represents a comparison between naloxone kits distributed in Ontario and with overall. As we can see, it's 147,000 in comparison to 3,000 of those being in Toronto Public Health Unit. Total harm events in Ontario is around 15,000, and half of those are in Toronto area with 8,000. Pharmacy distributed kits are still on the higher end of the spectrum, so people are probably more acquiring them for personal use, with that 62%. And the distribution benchmark is around 100% to 46% in Toronto, respectively. The following data also represents the cases of naloxone distribution province-wide. As we can tell, the northern provinces of northern parts of Ontario are very closely rival to the southern part of Ontario, which also can represent the rise of opioid crisis in Aboriginal communities. And one naloxone kit distributed in Ontario for every 100 residents is pictured in this graph. Benefits. When faced with a person in the midst of an overdose, every second is dire, and having a medication takes effect quickly is crucial. Naloxone takes anywhere from 2 to 5 minutes to take effect and restores breathing. Opioids such as fentanyl affect certain receptors in the brain. However, when applied, naloxone removes these opioids and binds the receptors for some time, ultimately immuning the person from such effects and stopping an overdose. Like my partner mentioned, however, most opioids take much longer than naloxone takes, thus reapplication must be considered. Here we provide an additional safety pamphlet from the Government of Canada that provides instructions to anybody who may require any instruction on using naloxone for the first time or just needs a refreshment. And there's a tip that if somebody is using opioids, make sure to carry naloxone with you, even if it's just for an emergency situation like a first aid kit, or have it in your car, because you never know when you can face somebody in the midst of a crisis.
So how does law enforcement within the region support this program? So specifically looking at Halton Regional Police, we see that as first responders, police are permitted in most cases to use discretion when enforcing the law. This is involving ethical decision-making plays in a critical role in effective and accepting standards of practice. As first responders, we have mixed feelings about harm reduction strategies used to fight the opioid epidemic. Posted on November 14th, 2022, the Halton Regional Police Service is making life-saving naloxone kits more readily available. The Chief of Halton Regional Police Service discusses that the safety and well-being of those they serve is paramount to their safety. There is an existing relationship with the Halton Regional Police Service that mobilizes the accessibility of naloxone kits. All uniform Halton Regional Police Service members have been trained in the administration of naloxone since 2018.
Additionally, most specialized units in Toronto downtown core are administered naloxone alongside firefighters and paramedics. According to Toronto Police Service, police estimate that over 1,000 officers will have naloxone on their utility belt, which roughly equates to 1/5 of the force. In Ontario, police services in Ottawa, London, Kitchener, Waterloo, and Peel region all have distributed the kit to their frontline officers in vulnerable zones. Others, including York, Durham, and Halton Region Police Services, have issued the antidote to selected officers as well. This is highly important due to the fact that police officers will be mostly the first contact to an emergency situation, and having the right tools to do their job is crucial. Thank you for listening.